The way in the battle against COVID, the FDA approving a new Pfizer COVID pill that has been shown to prevent hospitalization and death by more than 85%. High-risk patients will be able to get the pills in a few weeks.
We will have 265,000 treatment courses of Pfizer available in January, with monthly totals of pills ramping up across the year and all 10 million treatment courses delivered by late summer.
So Merck is also seeking FDA approval for an antiviral pill to treat COVID. Here to break down what makes these pills so effective is Dr. Matthew Harris, the medical director of the COVID-19 vaccine program for Northwell Health. Good to see you, Dr. Harris. Thanks for being here.
Good morning. Thank you.
So, doctor, all of the previous drugs to treat COVID required some kind of IV or an injection, but this is breaking ground here, new ground. Pfizer's new pill will be taken orally. So how will it be prescribed? When will we begin to see some kind of rollout?
Sure. So the Pfizer drug is really quite promising. It's a combination of two antiviral drugs that act on COVID proteins. And it really is significantly reduces the number of people who get hospitalized and die by close to 89%. The initial rollout is planned to go to local pharmacies to empower community physicians to identify high-risk patients who would benefit most from the medication.
Do we have any idea how it's going to be distributed? I mean, we know that places like New York and New Jersey are sort of at the epicenter of these huge explosions in the number of positive cases. Will they target it by how it's sort of blowing up around the nation?
Sure. I think if it follows similar paths as the monoclonal antibodies, that the federal government works with the Department of Health in both the city and the state to identify hotspots and target therapies to those patient populations that are most at risk. So it follows prior paths similar to the monoclonals. I think that's probably the case.
And so we had heard what does work and what doesn't work against the Omicron variant, right? How well will this pill work and be effective against the Omicron variant?
So what's interesting in the study put out by Pfizer and their preliminary data is that the mutation in Omicron seems to be susceptible to the new Pfizer pill. It hasn't been tested specifically in that patient population. But in in vitro studies, so in the test tube, when they tested it against viruses with a similar mutation, it does seem to be effective.
So let's just get this on the record. What is the gold standard for dealing with COVID right now?
Well, absolutely, without any doubt, the gold standard is prevention of disease. And that's prevention primarily through vaccination, through mask wearing and social distancing. Keep in mind that monoclonal antibodies, in many respects, are for treatment. When we have significant supply, there's also some prophylactic and post-exposure benefit. This pill, and presumptively the pill from Merck, are initially rolling out for the treatment of high-risk individuals who did not require hospitalization. Right now, we still don't have data on the prophylactic benefit or the post-exposure benefit of it, but we should be very clear that vaccination is the primary key. This is a tool to augment our fight against the pandemic.
And how many vaccines? Because we hear a lot about, we've got numbers of people who've received at least one vaccine. Can we even just talk about the fact that that's pretty much not effective anymore?
Yeah, look, I think that's a very reasonable assertion. What we know for sure prior to Omicron is that even the 2-dose regimen of Pfizer and Moderna and the 1-dose regimen of Janssen, that their efficacy begins to wane after several months. And the idea of a third dose becoming required as a primary series, I think, is a reality we all begin to face. There's some very interesting revelations out of Israel where they're even considering a 4th dose. I think right now, the CDC defines someone as fully vaccinated after 2 doses. I anticipate that to change to require a 3rd dose of the Pfizer.
I just want to reiterate here and shout out from the rooftops that the pill, because people are now, oh, well, there's a pill. Right. It's not going to replace a need for a vaccine.
Right. We should be clear that the intent of the vaccine is to prevent disease and to prevent the spread of disease. Once you require either the Pfizer or the Merck medication or the monoclonal antibodies, you are likely already infected.
Right.
And the intent here is to keep you safe and keep you from getting hospitalized and dying.
Doctor, let me just, while we have you, we're almost out of time here, but the pill comes at a time when hospitals and medical facilities across New York City are being stretched very thin with the surge in cases that we're seeing, right? Long lines for testing. What kind of impact is the Omicron variant having on the Northwell hospital system and outpatient facilities across the area, and who are you actually treating? Is it vaccinated mostly or unvaccinated?
So I can tell you as a pediatric emergency doctor, we're seeing a growing number of children, and I can tell you from my colleagues in the adult world, a growing number of adults. The positivity rate is skyrocketing throughout the health system and throughout the community. Thankfully, our hospitalization rate, which has been slowly growing, has not been reflected in the ICU rate. So the number of people hospitalized is steadily growing, but very few are requiring intensive care, and those who require intensive care, very few are requiring intubation. So right now, it seems to be a tsunami of diagnosis. But hopefully that doesn't translate into
But those that you are treating, to be very clear, that are in the hospital are mostly unvaccinated, or are they vaccinated in some capacity?
It's a difficult question to answer, because while many of the people who are sickest are unvaccinated, we live in an area that's fortunately very vaccinated. So the proportion of people in the hospital may reflect that vaccination status, but the sickest people we're seeing are clearly unvaccinated.
And from where you sit in the Northwell Health System, what is your holiday wish for families right now across the tri-state that are watching this interview?
I would love to come back from the holiday season without any devastating stories of illness and loss of loved ones. I think being safe, vaccinating, and testing before you go see loved ones is one of the ways you can help reduce the risk.
If you can get a test.
If you can get a test.
If you can get a test, my goodness. All right, Dr. Matthew Harris, thank you so much for being here this morning. Thank you for all that you and your team do really on the front lines each and every day.
We appreciate you. Thank you.
Be safe.